فقد كان عام استثنائي وأحداث متسارعة أضافت إلينا الكثير. لم يكن من السهل علينا تنفيذ المهام من اللجنة التنفيذية العليا، وبعد تشكيل لجنة السيرج كوميتي بقيادة المديرة التمريض دكتورة غادة عبد الله وتحديد المسؤوليات، فكان لكل وحدة من وحدات التمريض دور محدد في دمج الأقسام وفتح وحدات جديدة وتدريب الممرضات والدعم النفسي والفرز البصري، ومن هنا انطلقنا. كان فتح العزل 2 في 31 مارس الدرس الأول، ومن بعدها كانت ممارسات تمريضية موفقة مشتركة بدعم كل فرد من الطاقم الإداري.
التحديات اللي واجهتنا كمشرفين تمريض تحديات كثيرة الصراحة، كانت في كل وردية تحدي جديد. كان أولها علينا وضع الخطط اللي كان متفق عليها في السيرج بلان، موضع التنفيذ وقت ما نكون موجودين ونشرف على سير العمل بنفس مستوى ومعايير الجودة اللي متعودين عليها. كان التكيف مع التغييرات السريعة من فتح أقسام عزل جديدة ووحدات عناية مركزة جديدة والإشراف عليها، ووجود مرضى أطفال مرضى كبار في نفس القسم، مرضى جراحة ومرضى باطنة، كان جدا صعب في الأول.
Being a B team leader, it was such a challenging task along with limited resource to run the unit. At this time, our superheroes and our seniors were acted as a real hero and extended their utmost help to the real soldiers who worked on the real ground. At this moment, I am proud of my colleagues for their effort to overcome the situation.
To explain it in few words will not be enough, but still I can remember the hardships we have gone through and the success we have seen at the end. It's all because of the nursing as a team. We worked from the root to the top, which really proven how efficient and committed our team.
In this period, we had to open isolations unit to admit the infected patients. Isolation 2 unit was open, but with time, there was increased number of patients, which necessitated the opening of another isolation unit called isolation 3. To do this, we had to transfer units and merge units to provide a location for isolation 3. On this, we had to transfer nurses from a pediatric area to an adult area, and working in isolation units is really stressful and anxious for the staff because it's a situation that nobody can predict. And the hospital provided a psychologist which supported to provide them with emotional support and psychological support to prepare them in carrying out this task, as well as the nursing education, cross-train the staff from their scope of service to the new scope of service that they are going to work in.
We experienced an increased number of patients who needed dialysis who were COVID-19 positive. So our plan was to have a separate entry for a patient who is COVID positive. Deployed our nurses to help in the ICUs, and then we have our BD nurses to help in the hemodialysis. We decreased the number of waiting, the time waiting for the patients, so they come only for their exact time of dialysis, so to prevent crowdedness around the area. Alhamdulillah, after the number decreased, we stopped the third shift and we go back to normal, and we are covered, and hopefully inshallah we will not need in the future.
I'm proud to say that King Abdulaziz University Hospital and Nursing Department was really prepared to deal with this even before it spread all over the world when it is started. We had a surge plan, and the surge plan included everything: the staffing, structure, equipment, how we are going to expand our units in King Abdulaziz University Hospital, and the best thing was teamwork between all the departments, especially nursing under Dr. Ghada Abdullah.
نظرا لزيادة عدد حالات كورونا المستجد خلال الفترة الأولى من الجائحة، تم التوجيه من اللجنة العليا لإدارة المستشفى الجامعي بفتح سكن إبرغ الرغامة لتحويل الحالات المستقرة والتي لا تستدعي حالاتهم التنويم في المستشفى. تم تجهيز 5 مباني في كل مبنى 24 غرفة مجهزة تجهيزا تاما لاستقبال حالات كورونا المستقرة وكذلك المخالطين، ومن ثم عمل آلية لنقل المرضى من وإلى سكن إبرغ الرغامة. وكذلك جهز مبنى للعيادات مخصص للكشف ومتابعة الحالات عن قرب، وعمل المسحات تحت إشراف طاقم طبي متكامل من أطباء وتمريض مدربين ومجهزين للتعامل مع جميع هذه الحالات.
الحمد لله رب العالمين، تمكن قسم التعليم التمريضي بمستشفى جامعة الملك عبدالعزيز بجدة من المساهمة الفعالة خلال جائحة كورونا، وذلك عن طريق أولا التدريب المختلط بين الأقسام كروس تريننج، وقد تمكنا من تدريب 153 ممرضة، وذلك لاستيعاب العدد الكبير من مرضى العزل والعناية المركزة.
During the pandemic time, I will have to be deployed in isolation too, and then into medical ICU unit. During the pandemic time, there was a lack of manpower. That's why most of nurses were deployed to different units. During this time, most of the staff were having a lot of stress because of the changes of the environment and a lot of new things to learn, especially getting to different new unit. But gratefully, with these transitions and with these changes, the nursing education and the nursing body were helping everyone and hand in hand in training all the staff. During the cross training, I was able to face my fears in taking care of critically ill patients. It was out of my comfort zone because I never had any experience with critically ill patients. So it was a good opportunity for me to learn new things and to progress professionally. I was able to enhance all the skills that I didn't know I have before. So during the cross-training program, all of our nursing educators were giving us all the support, emotionally, mentally, and physically. Everyone was giving the support that everyone needs.
The Department of Nursing at KUH had formed a psychological support team in the beginning of COVID-19 pandemic. The team was consisted of 5 members from different areas like clinical, educational, quality, and nursing affairs departments. It held a periodic meetings and online lectures that was given in collaboration with the psychiatric team and psychiatric consultant Dr. Fatin al-Zibin. The aim of this psychological support team is to adopt an effective strategy to support the nurses during this pandemic.
The support team has launched an email to receive all the inquiries and concerns from our nursing staff, and also in the same time to allow them to express their feeling during the pandemic of the COVID-19. The rule of this team is to ensure that all the email we receive are confidential or treated in confidential way before we forward it to another department.
I would like to express my appreciation and gratitude for our hero nurses who never fail to impress us with their exceptional effort during COVID-19 pandemic and who exceptionally contributed with other healthcare providers to the success of the search plan of the KUH, which includes opening new units, opening new ICUs, close and merge some of the units. KUH nurses have not only extended their care for their patient but also for their family. I would like also to remember and appreciate our beloved nurses who passed away last year because of COVID-19. You will never be forgotten.